So at this point here, we'll begin to talk about this is Cecilia Nkemakolam Foundation, and this is a video clip based on the recommendation for the Action for Women's Health program proposal um, funded by Pivotal and managed by Leverage for Health for Change, and then submittable. And this is our own video. We're just going to show our profile and our capacity to be able to implement the program, the project that we have, clearly written concerning the strengthening of the adolescent girls and young women who are female sex workers and female drug injecting users. Those who inject drugs, the female aspect, the female ones among them are our key areas, our target population, which we're concerned about because they have face a lot of issues about rights, issues about stigma, and then involvement in, and so that we can be able to empower them through education and engage them effectively. And they're human beings, so because they are key population, they're most at risk population in terms of in transmission of HIV/AIDS. And so we are taking a proactive step in prevention of the and reduction in HIV/AIDS transmission. By providing service and intervention in this area, we'll be able to reduce effectively the HIV epidemic. And so we have used this opportunity to express our organization and our capacity. This is our capacity profile, and this is Cecilia Nkemakolam Foundation, like I mentioned. And here you can see where we have our institutional capacity just at a glance. You can see our name, you can see the sector where we work on as a non-profit and civil society organization. We have been existing since 2003, and we're fortunately registered on the 7th of June 2012. And we are also registered with the Corporate Affairs Commission of Nigeria. We also registered with SCUMO under the EFCC for money laundering, and we also to combat against money laundering, and we also were registered with the Federal Inland Revenue Service, which is the FIRS, and we have a team. And then we also registered with the US government, and we have a UEI number and registered under SAM, so that we can be able to access and also implement activities in that by any activity from the United States government and its allies. And so we also registered with the European Union, and we have our number, the European Aid ID, and we also enjoy special consultative status with the United Nations, and we since 2010, and also we also have our head office in Nigeria, in Abia State, and we also have zonal offices in Abuja, and we have other offices in Akwa Ibom and Lagos. And so we also operate from other territories. As the need arises, we can set up field offices and be able to implement our activities in that area, even if we don't have a physical presence, we can, provide such services, such of locations, through our head office. We can, as long as we are implementing programs in those areas, we can provide a field office, a small field office, to coordinate our activities within the time frame and within the period the project is supposed to be on or be carried out. And so we have other things like our staff strengths. We have about 35, permanent staffs and volunteers. And so We also go into our profile. We have been existing, like I said, since 2003, and we have a strategic approach, and that has been to deliver revolves to women and poor people in local communities to collaboration, learning processes, and adaptive management to achieve sustainable development outcomes in health, education, leadership, and entrepreneurship. We have worked with several donors. We have worked with the USAID under Enhance, with UNDP, with the US Consulate. We have also worked with other organizations, Society for Family Health, Action Aid, the National Malaria Control Program, Elimination Program, and the World Bank, and also Vitamin Angels, and then the Institute of Development Studies of the University of Nigeria. And so we have also worked with community stakeholders who have worked with schools within local communities, who have worked with health facilities, especially primary health facility system at the local levels, able to provide services for maternal and child health. And we have also worked in those areas extensively. And we have also worked with private establishments to fund us in one way or the other, like Tamakul, and then other organizations were coming and Clark. And so we have also worked in various areas uh, in this regard. And so we are here to say that we have also, so under our program and our project that we are working for to strengthen the adolescent girls and young women, especially the